When you walk into a hospital, you're entering one of the most psychologically programmed environments in modern society. The sterile white walls, the fluorescent lighting, the maze-like corridors, everything is designed to make you feel small, dependent, and powerless. What if I told you that this isn't just poor design, but deliberate conditioning that programs people to accept sickness as normal and to become dependent on external intervention for healing? I'm Dr. Marcus Thorne, and today, I'm going to reveal how healthcare institutions use environmental programming to create psychological dependency rather than promoting genuine health and healing. Let's start with the architectural design. Most hospitals are built with cube-based layouts, rectangular rooms, square windows, grid-based hallways. Patients spend their healing time in environments that promote structured, limited thinking, rather than the flowing, creative awareness that supports natural healing processes. The psychological effects are immediate and profound. When you're in a hospital environment, you automatically begin thinking in terms of categories: sick versus healthy, patient versus doctor, treatable versus untreatable. This compartmentalized thinking prevents you from recognizing the holistic nature of healing and your body's natural ability to restore itself. The lighting in most hospitals is particularly problematic. Fluorescent lights create a harsh, unnatural environment that disrupts circadian rhythms and suppresses the body's natural healing responses. This isn't accidental. It's the result of prioritizing institutional efficiency over patient well-being. But the programming goes much deeper than just environmental design. The entire structure of modern healthcare reinforces dependency rather than empowerment. Patients are expected to be passive recipients of treatment rather than active participants in their own healing. They're discouraged from asking questions, seeking second opinions, or exploring alternative approaches. The medical hierarchy exemplifies this perfectly. Doctors are positioned as authorities who possess knowledge that patients cannot access. Nurses follow doctors' orders rather than developing independent healing relationships with patients. The entire system reinforces the idea that healing comes from external intervention rather than internal wisdom. Time programming is particularly insidious in healthcare settings. Patients are scheduled for procedures, medications, and treatments according to institutional convenience rather than natural healing rhythms. They're trained to organize their healing around external schedules rather than listening to their body's natural needs. The pharmaceutical approach represents the ultimate expression of healthcare programming. Instead of addressing the root causes of illness, patients are conditioned to suppress symptoms with external substances. They learn to depend on medications for conditions that could often be resolved through lifestyle changes and natural healing methods. But here's what's particularly tragic. The human body has incredible natural healing abilities that are often suppressed by the healthcare environment itself. Stress, fear, and dependency, all promoted by hospital programming, actually interfere with the body's natural healing responses. Ancient healing traditions understood that healing is a natural process that occurs when the body, mind, and spirit are in alignment. They created healing environments that supported this natural process rather than interfering with it. Modern healthcare often produces the opposite effect. The solution isn't to reject medical care entirely, but to recognize how healthcare environments affect consciousness, and to maintain awareness of your natural healing abilities while navigating medical systems. I've researched these patterns extensively and documented how healthcare programming connects to the broader system of consciousness control. In my book, The Saturn Conspiracy: How Ancient Cube Worship Controls Modern Reality, I reveal practical methods for maintaining healing consciousness while working with medical systems. You can grab your copy for just $2.99 using the link in the description below. If you're facing health challenges, you can work with medical professionals while maintaining awareness of your body's natural healing abilities. Ask questions, seek multiple perspectives, and remember that you are the ultimate authority on your own well-being. Here's a simple practice. When you're in healthcare environments, take time to connect with your body's natural healing wisdom. Breathe deeply. Visualize healing energy flowing through your system, and remember that your body knows how to heal itself when given the proper support. The ancient wisdom teaches that healing is a natural state that occurs when we remove the obstacles to health rather than adding external interventions. When you understand this, you can work with healthcare systems without becoming dependent on them. Healthcare programming works by convincing people that their bodies are fragile, unreliable, and dependent on external intervention. When you remember that your body is a sophisticated self-healing system, you can participate in medical care from a position of empowerment rather than dependency. Tomorrow, I'll show you how the same programming principles appear in entertainment systems and how media institutions use psychological conditioning to influence behavior on a massive scale. But first, check out the Saturn Conspiracy and start recognizing healthcare programming in your own experience. The ancient wisdom is still available to those who seek it. The question is, will you remain dependent on external healing, or will you reclaim your natural healing abilities?